You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your Physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
All right, good evening, everyone. Can you guys see the screen? There's a big UK logo.
Yes.
Yeah, maybe. Perfect. Well, welcome. First off, thanks to PM&R Scholars for hosting the second annual Virtual Residency Fair. And thank you to everyone on the call. I know there's a lot of other things you could be doing with a Tuesday night, but we're honored to be a part of your evening, and we're excited to present to you tonight. So we are University of Kentucky. My name is Nick Elwert. I go by Dr. Nick. I'm one of the recent graduates and current faculty members here at UK. Tonight, we have quite a few of our residents. So we have one of our chief residents, Nate, one of our fourth years, Mike Parrott, one of our third years, Jen Murphy, and then our moderator tonight, Belle, is actually one of our interns. So again, we're just excited to be here with you. So this is us. I say us, even though I'm not pictured. This is my heart and soul. I love it here. That's why I stay. So here's all the things that we are going to discuss. We're going to talk about the program leadership, the basics of the program, resident rotations and how much hands-on experience that you get as a resident, and then where do residents go? So obviously the part of this thing called residency is to get a job afterwards, whether that is a fellowship or being an attending somewhere. And so we'll talk about where our residents go, our didactics, our resident wellness initiatives, and then Lexington as a whole. Throughout the program, you're going to be hearing from all of us. Dr. Parrott is going to be answering questions in the chat. And so if you have questions as you go ahead and throw those in the chat. And then at the end, we'll have time as well. So Nate is going to lead us off. And so take it away, Nate.
Hey everybody, I'm Nathan. I'm PGY4, one of the chiefs. So I just wanted to tell you a little bit of our program overall. It's a categorical program. We take 5 residents per year. Some of the main just kind of benefits on top of your salary are during your first year, you actually get 2 books, the Bradman Frontera textbooks for PM&R, kind of some of the basics. And then as you come into your second year with us, you actually get a laptop, an iPad, as well as Cucarillo, a big brain injury book for you, and then the oral board test question book. And then you can also pick 2 books of your choosing. So kind of whatever PM&R books or PM&R related books, kind of totally up to you, as long as you can justify how it's slightly related to PM&R, they can get those for you. And then as a third year, they just give you $600 to kind of do as you want with it for educational purposes. So you just send them your receipt and they'll give you $600 for whatever that you need. And then that kind of goes for in your PGY 4-year, it's $1,400. And so you can use this for PM&R Recap or any other educational resources that you need. Extra books is what I use mine on for my PGY 3-year. And then you also get 2 paid conferences. So they'll send you to AAP as a 3rd year, and then as a 4th year, they'll send you to AAPM&R. So really looking forward to AAPM&R this year. You also get personalized scrubs and a white coat every year. You get multiple of them. I think it's pick and choose 3. So if you want to do 1 year all scrubs, the next year all white coats. They're embroidered. The white coats are pretty nice. The scrubs are scrubs. And then you can apply for multiple research or travel opportunities every year. So I just applied to one to try to get my AAP fully covered as well. So if that's something you're interested in, you can try to go to multiple conferences and get them all paid for every year. Some other things that we do offer: free parking. There are meal stipends in your check. You get discounted memberships to both employee gyms and student gyms. And you get multiple discounts throughout the community. If you go through the website, you can find some discounts around stuff around town. And then something that they just added, which is really nice, is a retirement match. So they take a portion of your paycheck if you want to put it towards retirement, and UK will double it. So super nice. It just got added on. We've been trying for that for a while. So it's a big benefit for all the residents here. So this is just us at some conferences. These are some recently graduated residents. That's Dr. Nick. And that's just a big dinner that everybody celebrated on. So we're kind of a big family, so we try to hang out as much as we can, even when we're out of town. These are just some more pictures of us kind of throughout our clinic. Some of these are at a rehab hospital. Some of them are at our clinic. Those are our clinic staff right in the middle. And that's Dr. Perry in the bottom with Dr. Nick in our MSK department. And the big horse is over at our rehab hospital. So Lexington is the country of horses, you know. So let me just tell you a little bit about our PGY 1 year. So these are how the rotations are broken down. You do 4 months of internal medicine throughout the year. It's inpatient, half of it's over at UK and some of it's over at the VA. They're not 4 months back to back, they're kind of split out throughout the year. You also do 2 months of inpatient orthopedic surgery, 1 month of neurosurgery, and 1 month of trauma. For the most part, you don't get too much into the OR unless you want to. That's kind of up to you, personal preference. And then you do 1 month of neurology. You do 1 month of outpatient orthopedics, which is a new rotation for us, 1 month of outpatient pediatrics, and then 1 month of PM&R. This is really a great first year foundation because you get so much internal medicine, and then the surgery months you really get to know the people and the services, and really these are your main referrals to the acute rehab. So you know who's sending them to you, you know the patients, you just treated these patients acutely over at the big hospital. And so when they come over to you as a two, you're very comfortable. You're very comfortable treating pretty much everything, honestly. So this is just a breakdown of some of our outpatient rotations throughout the 4 years. So kind of like we talked about, during your first year, you do 1 month of PM&R clinic, 1 month of outpatient orthopedics, and 1 month of pediatrics. But then as your second year, you do 2 weeks of interventional pain, 2 weeks of sports med, and then you do UK clinic, which is about 1 to 2 months, depending on your schedule. And that's a lot of MSK, spasticity management, Botox injections, and you get a lot of Botox injections probably at this clinic. I mean, I had all of mine done probably by the first, not even the first month, probably the first 2.5 weeks. I had checked off all of my Botox, all of my pumps. We get a ton of baclofen pumps in this clinic. And then we do 2 to 3 months of the VA MSK, and we do a ton of knee ultrasound guided injections. I mean, that's where we get the majority of our shoulders, hips, knees. I mean, we have our attendings there are really well trained, and they love teaching, and they're really great with the ultrasound. So everything that you do with the ultrasound there. And it's nice because it's the VA, so it's a little slower pace. So the time for teaching and they have a ton of time for teaching. And then as the third year, you go back to the UK PM&R clinic. So you do some more MSK, you do more spasticity management, do a little bit of everything, more pumps. And then you go back to that VA MSK. But this year as a 3, you do mostly, well, you do about half amputee. So you get to learn the amputee side pretty well. You get to do a lot of prosthesis. You get to see some inpatient consults, so you can kind of follow that amputee patient all the way through. And then you get your experience for pediatric PM&R over at the Shrine, which is a hospital. It's across the street from our main hospital. It's a very nice hospital. You get a lot of orthopedic as well as PM&R training there. And then as a 3, you can pick an elective, and we'll talk about the electives a little later on. And then as a 4, you go back to do the VA, but now you're mostly doing EMG. You also do a lot of 2 months of UK EMG. And then you're over at the UK PM&R clinic, just fine tuning your skills, kind of being a pre-attending as far as seeing patients and getting really good with spasticity and doing a lot of Botox, a lot of pumps, and just seeing all the MSK patients and just kind of really honing in your skills to that point. So these are the inpatient rotations. So as a PGY2, you do stroke rehab for 2 to 3 months. You do brain injury for 2 to 3 months, and then you do kind of our general or orthopedic. So these are a lot of trauma patients. for 1 to 2 months. And then as a PGY3, you go on to spinal cord for 2 to 3 months. And then you go over to UK Chandler, which is kind of our big center there, and you do consults for 1 month. And then you also do our teaching utility team, which is kind of a mash. You can get some brain injury, you can get some stroke. And they kind of really there, they try to let you be a senior on the service. They want you to be the attending. They want you to do everything, which is great learning experience for when you get out. And then as a 4, you do a little bit more consults. You do about 2 to 3 months. And then you also have another month of that teaching utility team. So these are the electives we kind of talked about earlier. You can kind of pick whichever ones you want. These are just some of the most common ones people do, whether it's interventional pain or VA interventional pain. If you just want to focus on your ultrasound technique, you can do that. If you want to do sports medicine, if you really want to focus on spasticity management, baclofen pumps, things like that, you can make up your own elective if you really wanted to. Honestly, everybody here is really open to things like the administrative and leadership is a brand new elective that was just started last year for one of our residents.
Thanks, Nate. So I know one of the questions always is where do our residents go? So as Nate mentioned, you are very prepared at the end of your 4 years here at UK to do whatever you want to do. So the intern year really sets you apart from other intern years in regards to any medical or surgical complication or patient that you will take on in the rehab setting, you feel very comfortable managing. And then as you go through our program, our graduates feel very prepared in doing whatever they so choose. And that is really outlined here. When you take a look back from all the way to 2014 in each consecutive year, you can see that if someone wants to go into a fellowship, they go into a fellowship. If someone wants to go into academics, they go to academics. If someone wants to go into private practice, then they go into private practice. I think the distribution really focuses and really kind of highlights that when our residents are done, they don't feel like they have to go and do a fellowship if they don't want to. I'm a perfect example of that. I do neuro rehab, so Botox injections, baclofen pump refills. When you look at our resident numbers, we are in the 91st percentile for compared to all programs for all procedures, and in the 96th, 98th, and 95th percentile for ultrasound procedures, baclofen pumps, and Botox injections. So this just kind of highlights that whatever you want to do, you can do such. We have peds, we've got pain, hospice and palliative care, spinal cord injury, etc. So one of the things that Dr. Key is really her passion. Dr. Key is our program director. I will mention she really wanted to be on tonight's call, but was unable to. So she apologizes, but definitely looks forward to meeting you all on other virtual opportunities. But this is kind of her baby. This is her passion. And we know that wellness is just not making sure that someone is physically well. It's not making sure that someone is just hanging out with others for social wellness. And so we have a separate wellness committee that Dr. Key is the chair of, and it focuses on each one of these initiatives and making sure that us as a program that we are offering the wellness, offering the tools that each resident needs to make sure that you are well in each category. So like, for example, yes, we do have a Peloton. For physical wellness. We have a actual workout room now that has grown throughout the years. And so we will dive into these on other virtual opportunities, which we'll talk about at the very end, but this is kind of a highlight of what we do from a wellness side. And as you can see, we like to get together. I think one of my favorite pictures here is at Vanessa Roos here in the wedding dress. It was her wedding. She is one of the 4 who is staying on here at the program as well. And I think that's a great picture. Real quick about our didactics. It's every Tuesday and Friday from 7 a.m. to 9 a.m. It actually goes from 7 a.m. to 10 a.m. Starting in October. So you get an extra hour of didactics to focus on our that is complementary to our SAE schedule. All didactics are protected from clinical responsibility. So you are handing the pager off to likely myself or Dr. Key or one of our other faculty members. We are answering all the pages during that time so that you can be fully focused on what is being presented in didactics. We have essentially a 16-month rotating schedule. So that means each year you have a course called the I Am a Physiatrist, which is the basics of PM&R, our anatomy course that incorporates ultrasound, some injection models, as well as our cadaver course. We also have our SAE review schedule and our career development course that happens every year. And then every other year, we have a rotating schedule between our EMG course, our rheumatology course, cardiopulm, neuro rehab, amputee, and P&O. Some of the newer features is virtual grand rounds, which I believe are going to be restarted kind of later in the year. We have our SAE review course that has kind of molded and changed throughout the years based upon resident feedback. And then we also have chief rounds, which is essentially residence-based lectures where you either lead your prospective residents through a case, or you give your formal presentation as a PGY3 where you pick a topic and then you become an expert on that topic and present a lecture in a grand rounds format. With that, I'm going to turn it
5
over
minutes
to
left.
Murphy.
All
Oh,
right,
you're
hey
muted.
guys. Yeah, I'm sorry about that. So I'm Dr. Murphy. Just call me Jennifer. I'm a third year. So here you can see our rotation locations. Top left is the Big House, UK. That pedestrian crosswalk crosses down and circles around to the bottom left. That's actually Shriners Hospital. The Cardinal Hill Hospital is the bottom right. That is our standalone rehab, inpatient rehab hospital. It is just about 10 minutes away from the main hospital, so it's not much of a commute to go back and forth. And then the top right picture is the VA hospital, one of the VA locations, which actually is, you can't see it in this picture, but it's right behind the 2 twin towers in the top left. There's actually a pedestrian walk that gets you into that building too. And that's where all the top pictures are where all your intern rotations are for the most part, minus 1 clinical month, or the 2 clinic months, sorry. So again, this is Chandler Hospital. What's the big deal about Chandler for us is the acuity and how complicated the patients really are in my mind as far as training goes. Yes, it's a big hospital. There's lots of other big hospitals. It's a level 1 trauma center and pediatric trauma center. But I think we were rated like top in the nation for just how complicated and acutely ill our patients were for various reasons, because of the catchment area and because of lack of care and just the region itself and the general comorbidities that exist here. We also have the Markey Cancer Center. If you're interested in cancer rehab, that's a program that we have and kind of in the making and being constructed all the time as well. Again, this is another picture of Cardinal Hill. I think the interesting part about Cardinal Hill is that it was originally built as a polio rehabilitation hospital, so it's got some great history in rehab as well. It's a beautiful building. It's been super well kept. We have lots of good technology there, kind of listed there. If you're a student listening and you haven't got to see any of this, the Locomat, Geosystem, the Fees bike, it's kind of like a biofeedback bicycle. All these kind of things are things to be looking out for when you're on your PM&R rotations to kind of learn more about, take the opportunity if you get it to get exposure to some of these technologies if the places that you're rotating at have them. So a little about Lexington in general. It's not a very big city, definitely has a small town feel, maybe because it's a southern city. It's the horse capital of the world though. Rated great on, however these ratings go, 8th best city to live in America. It's definitely a safe place to live. as to do as well. Unfortunately, I didn't get to go last year because of COVID, and I didn't go intern year because, well, it's intern year. But hopefully I'll get to go. There's 2 meets in the April or in the spring and fall, so hopefully I'll get to be a part of that at some point. But there's the Kentucky Horse Park that you get to go and see former racehorses and all the great history that you can go to anytime. Outdoor life, plenty of stuff to do in Lexington, but also in the surrounding area. Raven Run is, 10 minutes outside of town, some good hiking. Red River Gorge, nationally rated climbing there, hiking. The Daniel Boone National Forest is there. The Pinnacles is beautiful hiking down in Berea for a short hike if you just want to see a beautiful overlook, and the Appalachian Mountains, all within an hour. It's kind of the farthest place away there. And then, of course, I think Kentucky's known for Mammoth Cave. It's just a ginormous cave about 2 hours west of here. So an hour and a half, I guess. It's not quite that far. But it's one of kind of like the notarizable places to go while you're in Kentucky. If you get to come and visit here or come here to stay, you got to check that place out. It's one of the biggest cave systems, I think, in this part of the country.
And sorry to cut you off, Jen, but we'll put up the slide for Wildcat Wednesday, and that's the end of our time for UK. I'm so sorry, guys.
Thank you, guys. If you want to join us, come to Wildcat Wednesday, and then you can come to take advantage of our observerships, come and do a shadowing experience. Thanks, Bill.